Wow. What a fantastic turnout, and I must give a full tribute to the people who organized this. An amazing job that they've done for tonight. I'm going to talk to you a bit about a personal journey as it relates to wind turbines, but I'm going to go back a little further historically. One is I am a doctor. That means I care about other people's health and well-being. Simple as that. I felt that way since I was about age 6. Hopefully it will never change for me. I'm going to talk about a principle that is of enormous importance that I learned more than 60 years ago, but was first espoused at least 2,500 years ago. That principle is simple. First, do no harm. And that is when you undertake something, whether it relates to something you're doing as a physician or in any role you play in life, first, do no harm. Somehow or other, we've lost track of that. I'm going to talk to you now about my own journey, starting in January 2008. Because at that time I wanted and was convinced that I was going to pursue the notion of a wind turbine. And I talked about that, thought, well, that'd be nice. I think it'd be income and it's green, and that's good. That story has been told by many. But then I made a mistake, or maybe the contrary. I read about it. As I did the research, I became increasingly concerned. Concern led to alarm. I went to a meeting on August 2nd. Dr. John Harrison, Professor Emeritus of Physics in Queens, spoke, and he did it in a scholarly and compelling way, and that was a watershed in my life, because he talked about wind turbines. He talked about the fact that there was an issue with sound, and there are more issues. But what he talked about was low-frequency noise. There's a broad band of noise wind turbines make, but the whoosh, 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 the pulsatile noise that so many around the world have described as a problem. And he said that the interior regulations and the discussions he was having, he was used as a consultant by the government, were clear. They weren't considering the setbacks seriously enough. At that time, he was recommending 1,500 meters. The turbines have since gotten bigger, so the setbacks are required to be larger. That very day, I wrote to all 3 levels of government, the people who represent Prince Edward County at the council level, the province and federally, and said that I was concerned. And I pointed out a few things about the adverse health effects that were possible. At that point, I thought in terms of being possible. My research continued, and on November 28th, I made a formal deputation to Prince Edward County. And I said, there's a problem. I said, I believe there's a problem because adverse health effects have been reported around the world, and still are. There's a problem because there are no regulations in Canada or Ontario. There's a problem because everywhere you read in World Health Organization and others is that low-frequency noise is a special concern when it comes to health effects. There was a problem because the World Health Organization and others suggested you should measure for low-frequency noise specifically. The Ontario government had not done that, continues not to this day. Time passed. December 15th, 2008, our council passed a resolution to have health studies. Over 60 have followed suit. The Federation of Canadian Municipalities followed suit unanimously. Health studies for turbines. I went on August 22nd, 2009 to the Green Energy hearings and made a presentation before the Standing Committee on Good Governance. I said there was concern. People around the world were being made ill. That there was a particular concern with low frequency noise and infrasound. That we didn't and weren't measuring it. That at that point I reported on 53 people who'd become ill in Ontario that had been documented. I asked them to do the health studies again. I said, we must do the health studies before more development. Once again, it was a matter of waiting, a delay, a denial. I submitted in July, in regards to the regulations, a piece that quoted the wind industry, a man named H.D. Leventhal, and he said, he's an acoustician, that 4 things should be measured. One is you should know the intensity of the noise, decibel A or C weighting. But the intensity of the noise, the pitch, the time of exposure, and the effects on people. Those 4. Coming from an industry spokesperson. He said, if you don't measure all those, then you're going to fail. Well, the regulations got passed, and they measured only decibels, or sound intensity, and they did not make any adjustment for low frequency or for sound. And they acknowledged they don't know how. So the problem continues. People are being put in harm's way. The next stop was September 28th, when I again presented to our city council. Again pointed out there was an issue. People are reporting adverse health effects. They're doing so documented. We now had 87 people that we had documented. There weren't regulations in Ontario or Canada or anywhere that were protecting them. We need health studies. That was said again. And what that was met with is delay and denial. One small concession was they said they'd create a research chair. We've subsequently learned it's with very little effect because they're going to be doing surveys for 5 years. It's not going to help us. It's not going to help the people who are sick. So time passed, and you'll hear more from Ian Hanna. On October 16th, 2009, we launched a legal challenge and asked for a judicial review of the regulations and act, because they're not protecting people. They're not protecting people. We had no other choice. It seemed that the only place where the truth has a chance is in the court of law. And that's what we are pursuing. We've gone through initial stages, and you'll hear where we're at later from Ian. It continues. We carried on. In January of 2010, we formed something called the Society for Wind Vigilance. And back in 2008, I can tell you I felt lonely. It was hard to find people to support what we were concerned about. And suddenly it was changing so dramatically. Right up to this very week, we have engineers, acousticians, lawyers, doctors, including anesthetists, sleep experts, radiologists who understand physics of energy in the body, family physicians who've seen people with the problem. We have a man who's an expert in energy and has written 4 books about it. We have a psychologist, and the list goes on. The number of disciplines is extraordinary. It came together in the Society for Wind Vigilance. And I'll tell you the key to all of that is that hard-working people like the ones who set these things up tonight. We meet monthly on teleconference, and it's exciting, but it's also despairing because the same message keeps coming through because we're talking to people in the United States, in the United Kingdom, in Australia, New Zealand, Sweden, Japan. We hear from Romanians, Poles, and people across Europe. We talk to our colleagues in Quebec, Saskatchewan, New Brunswick, Nova Scotia, and the message is always the same. There has never been health studies in association with wind turbines that have been going for over 2 decades. We continue to be willing, as a policy initiative, to put people in harm's way. We do not know the effects of the noise, and there's other effects that you'll hear about, on people over the long term. The final thing I'm going to tell you about is that enough, we all thought, and we are organizing a conference, the first international conference on adverse health effects, October 29th, 30th, and 31st. It's open to all. It'll be in Prince Edward County. And it has attracted the best people from around the world. We have people come from the United Kingdom, from Australia, from the States, from all around Canada. Nina Pierpont, who's going to speak, who wrote Wind Turbine Syndrome. And they're coming together for one reason. It's the same reason. The denial, the delay, in the continuation of putting people in harm's way without setting proper regulations to protect people. Make no mistake about it, the current regulations in Ontario will not protect us. We don't know the effects it might have on children or the elderly, but we do know that people from all walks of life are affected. And we do know that the delay and the denial continues. Month after month, and now year after year, we have not been able to seek the truth. We have not been able to get the research done that will tell us what we need to do. The need for research has been stated in France. It's been stated by the leading European Union researchers headed by a woman named Asia Peterson, that we need to do the appropriate research. The denial continues. We are at a crossroads. This is not inevitable that the turbines should go up, although you'd think it from the advertising and the promotion. The other side has the influence. The other side has the money. The other side has a lot going for it. All we have, all of us who are concerned, is one thing: the truth. The truth cannot be defeated. We have been delayed and denied for quite a substantial time. Tonight, I hope you'll join me in saying enough. It is time we did the research that will determine the way in which we can hold people safe. Enough. The truth must out. Thank you very much.